What's your name?
My name is Daniel.
All right, Daniel, are you ready to tell us what you're building in a minute and get some feedback?
Yeah, sure.
You have a minute. What are you building?
Hi, I am the CEO of CloudMedic, and we help patients get medical supplies quicker and help suppliers get reimbursed faster. So 40% of Americans live with at least one chronic condition, and they wait weeks to receive their medical supplies. What we do is we help them get that stuff faster on the supplier side, on the operational side. And the way we do that, to backtrack, this is done in the diabetic, for example, in the respiratory spaces when they need these supplies and they just can't get them due to the operational overhead. $63 billion industry, and they have the same pain points with insurances and clerical work as every other healthcare startup, every other healthcare situation. So we help with order management, billing, and insurance collection, stuff like that. We have a few customers, and we're looking to onboard the next cohort very soon.
All right, good job. This is your space. I'll let you go first.
Yeah.
Wow. I mean, so super interesting problem. It didn't come up until much later in the pitch that the problem driving for why patients had to wait for so long was because of billing challenges or, paperwork with the insurance company, potentially prior auth. So I would maybe have started somewhere in that realm. Like, this is a super big need. This is the experience of a diabetic patient today. Here's what we're doing to solve that problem. And we monetize via X, Y, and Z. We didn't really hear much about the business model, so I'm not totally sure how you make money or who your customer is. Is it who pays you? So maybe a little bit more context around that in a minute would have been helpful.
Why don't you give some of that context?
Yeah. I had a different version of the pitch before I came, and it's the nerves that took over. So our customer is the medical supplier, and we charge them currently on a monthly subscription basis.
I just want you to understand that that's very surprising to me, which is not a good signal as to this new pitch. Just to, add on to the feedback that Nika gave already, sounded very much like the patient was your customer. I know you said, I did hear you say reimbursements for medical suppliers as part of the pitch, so it's not that I wasn't listening, but it still was so centered on this user experience without even getting to those details. But just want you to feel that. But go ahead.
Correct. But before I answer, the point there is that many people aren't familiar with this pain space, right, of the medical supply and how much that affects the patient on the availability. Because we have Amazon today and people get their products, but when it comes to insurance overhead, people don't get those things as quickly. There's a lot of clerical work that happens. So I really kind of spent a good amount of time understanding that and then go into the next part. But yeah, so the supplier is the client, and when we help them, that gets results to the patient because the supplier is our customer and the patient is their customer. So that's kind of how we do that. Right now, we're on a subscription basis, and we will go into the operational
What are you doing
side.
for them?
So we help them with processing their orders. We help them fulfill their orders.
What does help mean?
Help meaning we have a platform, end-to-end vertical software that we built the EMR, we built the order management intake, we built.
What are they using today?
It's very fragmented in the medical supply space. It's not like the hospital space, and so there's
why is that bad for them?
Why is
what's the negative of the fragmented space right now to the supplier?
Nobody is solving the critical problems, and they're just kind of attacking the critical problems of trying to get these automations and paperwork done quickly. So, for example, there's a case where you need to hire somebody at $60K a year to resolve one problem, just correspondence with insurance companies. We can resolve that.
What does the problem look like?
The problem is I'm sitting there and I get a request from insurance company to follow up on paperwork, and they need proof for why this item.
How do you solve that?
So we solve it by automating the responses via templates and Gen AI. Then there's other automations that we do.
I've had to pull your tooth to get the first good thing about your product.
Correct.
So something to think about. My series of questions is because none of this is coming across.
Correct.
I think you're saying these labels of supplier and patient, and there's a problem. But what is the problem? Well, the problem is not that there's fragmented solutions. That by itself is not actually a problem. Yes, we can guess what fragmented solutions means, which is like the UI is bad and it's not all connected and there's a lot of paperwork. But what we really mean to say is the fragmented solutions are causing delays because insurance needs responses, and the EMR is not well integrated with the supply side CRM. The CRM does not properly track orders, and so if the warehouse is a third party, then you're not properly communicating as a supplier with your warehouse. All of those things are the problems that you have to get out, because otherwise we're not experiencing anything other than they have problems.
Yeah.
And then you have to mention your solution, because, for example, an automated template-based form on something that is structured data and probably is not that subjective. It probably has a bunch of rules. And GenAI is probably very great for this use case.
Correct.
So this is where I think your pitch needs to orient a lot towards this stuff.
Correct. And because,
can I just also add on to that? I actually think you could even be one level simpler, which is like, are you saving the suppliers time? Like, is it basically like they don't actually need to have so many people working on paperwork, filing, or calling up insurance companies, and so I'm saving them a ton of time. They also get paid faster. I mean, I'm not sure. I'm just, do they get paid faster because the product gets the patient faster? Are you enabling them to basically, I don't know, get their products out or buy products at a cheaper price? I bet, a lot of what you're talking about from the higher level perspective, you especially would be sympathetic to hearing there's a doctor also in this relationship who's frustrated in addition to their patient. And those two But it wasn't clear to me if this existed in like a home care setting and in inpatient setting. Like, you said you don't work with hospitals, so it's not, what does the patient journey look like, right? How do I even get the product? So in some ways, I think an example would be really clarifying. Like, look, you're a diabetic patient. You come into the hospital. I'm not sure. So you come into the hospital, you realize you need X, Y, and Z supplies, and then the doctor prescribes. How does that work?
So, by the way, as the non-expert, before you answer, that the reason what she just said is so compelling. We've had so many pitches that have shown me as someone, my mother and sister are physicians, but other than that, I'm not in the world that you live in or that you live in. And so they've taught me things about some of the problem, for example, with physical therapy is what happens after the first month, where it's like, it's very scheduled and segmented based off of the surgery you might have had, but then it's up to the patient in compliance or, inpatient and outpatient settings. So there's nuances in the setting that you did not get to that, again, doesn't allow us to imagine the upside of your product. Right. And I think, again, you can respond to some of this in a sec, but I really want you to live in it, because part of the reason I am pulling teeth here versus giving up on you is because it sounds like a great solution. If you properly describe the problem and solution, we all probably want this to exist. Yeah. So I'm going to shove you into the pool so that you can, come up and tell us all about it.
It's a good thing I was a swimmer for many years. So the way that the workflow looks, the patient goes to the doctor writes a script. That script gets sent to the supplier. The supplier is usually national or a smaller local player that fulfills that order on behalf of the doctor and then bills the insurance. So the way that works, that script comes in, they put it into our platform, they schedule a delivery, and we have logistics and mobile app that help their drivers deliver it directly to the patients. So we do all that handling on them. When the delivery gets done, patient signs directly on the tablet, goes directly into the patient chart. So it's another automation that we added in the stack. Once that form comes in, our client can bill the insurance companies, wait for the money to come in, put it back in, and get reports and analytics on things that are going on in their business and their revenues and stuff like that. So this is the full stack. Now, that's kind of the workflow. So hopefully that answers your question.
Super helpful. And then what is the world without your solution?
Yeah. So the world without our solution, we started because my co-founder has been in the space for 12 years, and he was using a server that was locally running from a software from 1996, and many people still do today in New York. And we took that and we automated it in such a way where it's in one platform.
What's the literal experience of the supplier right now without your solution? What's happening, or to the patient, whatever, without CloudMedic?
The patient gets their supplies within a day or two instead of a week. and the supplier can bill within
No,
15
without.
minutes. With us, they can
CloudMedic.
bill in 15 minutes. Without, it would take them 8 hours.
Let me
to
ask my
bill.
question, then I want to give you some feedback on this. And again, I want to pull this out of you because I think this product needs to exist. And so, no worries. This is a stage
I'm a
lights
highly
here.
technical guy. That's
And we've chatted, and I know you're building for the right reasons. So, why are the suppliers not themselves, or up until 2024, they have not been biting for this? So tell me, whether it's your co-founder has a story or you have an anecdote, why have they decided to continue to live in the past? Why is it a locally run server with an application from the 90s? What is it about suppliers or this relationship or this market that has not had them modernize?
A lot has to deal with they're not aware of what's out there, and they're not aware of the technology that's out there. They use 3 different platforms.
But I'm sure they don't want a patient to go through 2 weeks of delay, right? When that happens, what are they feeling?
A lot of the time, the patient has no choice.
No, the supplier.
The supplier...
Do they not care?
Orders come in and they fulfill it, and they are looking for solutions, but they're not really out there.
And they're not incentivized to make it faster? Or are they? Like,
the legacy players are not really trying to make it
why
faster.
aren't their competitors making them outdated? Why haven't they been replaced by suppliers who care more? Are the margins too low in this business for competitors? Is it because these competitors tend to be big conglomerates?
The competitors are big conglomerates. So they were actually acquired by one of the main competitors was acquired by a manufacturer. So you can think that there's a possible.
So let me round some of this out, and I'd love your thoughts on how I round it out. It sounds like your suppliers here are legacy businesses who don't have a reason to care. Probably the margin's low. Probably the desire for change from even providers or patients is overridden by the desire for like reliability. Like, I want the right meds more than I want to like push. When I push, there are too many stakeholders and approval processes involved. So when you were describing earlier a little bit more clearly the problem, what I imagine is a circle of stakeholders. And I actually don't like usually circle-based problems. I usually like chronological stories. But the reason I think of it this way is you could say something like, look, let's take the example of a diabetic patient who needs supplies. They have a doctor who cares about them getting supplies. They care about their health outcomes from a supply perspective. Supplier wants to have that patient for life. That'd be great for them from an LTP perspective. And that ecosystem, and maybe there's 2 other stakeholders, the insurer, I don't know. All of these stakeholders care about this thing happening. But there are 5 or 7 or 10 reasons that it doesn't happen. The systems aren't integrated. The shipping has this complication. The approval processes required are outdated, whatever it might be. And these 7 to 10 reasons prevent all of this circle of stakeholders from getting the outcome that they want. And what our solution does is it takes the piece about automation, integration, that takes the piece about delivery, it takes this piece about patient communication, because you might tell a story like, one of the reasons that diabetic is going to get a 2-week delay on whatever they need to their home is because by the time they realize something's missing, they have to call the supplier and say it's missing. The supplier's going to say, okay, call us back tomorrow. Hang up. Okay, tomorrow you call them again. Hey, it's missing. Oh, this is a ticket in our system. Sorry, call us back tomorrow. Okay. Then the next day, okay, now you need to call your doctor. The supplier calls back and says, you need to call your doctor because we don't have actually the prescription we need. They call the doctor calls that office. Then the doctor calls that office, but fills for a brand name versus a generic. I mean, now I'm thinking about pills, but whatever.
Yeah.
I don't know how
the pharmacy space is very similar. They're actually merging.
So this is why, you just hear that I'm describing this, because then what you say is, well, what CloudMedic does is all of that is visible to all stakeholders at all times, allowing for any of those stakeholders to drive towards outcome X in 1 or 2 clicks.
That is the end solution, because bringing all stakeholders visibility is easier said than done.
Yeah. I think my sense is that the friction here is really real, meaning like the incumbents actually do have a lot of power. The existing solutions, they're not good, but not good solutions within healthcare has existed for forever, and people just live with it, right? People just learn to, right? I mean, like, think about have you ever met a doctor who loves Epic? No, but like, is it still the leading EHR? Yes, absolutely. Do I think anyone is going to displace them anytime soon? No. And so my worry here, and this is maybe just like giving you like behind the curtain, this is what I'm thinking as an investor. Yes, you're solving a problem. Yes, it does exist, but like your value proposition has to be so valuable that like it has to overcome all these other different pieces, right? And I think the challenge within this space is when I've talked to, and I know you're not necessarily integrating with hospitals or health systems, but I'm going to talk to hospitals and health systems who are managing their supply chain. I've asked them about this, like, what software do you use? Is it still super manual where you're counting up different number of supplies that you have within your back office? Yes, absolutely. Does it take a lot of human power? Yes. Can we figure out a way to apply technology to this? Yes. But do we not do it? Do we not apply technology and do we just use humans? Yes. Why is that? Because the county is paying for our existing Oracle software. Does it suck? Yes. But is it integrated with, Epic? Yes. So do we use it? Yes. Is this what our doctors are familiar with? Yes. And so we're not going to change our entire, tech stack to integrate with a new solution that makes our lives marginally better. But it has to make our lives incredibly better. So I'm thinking about, okay, how good is your value proposition that justifies me spending all that time? So that's I need to hear you say this is super painful and I'm willing to pay a lot for it. And even though it's going to take a lot of change management and investment in new technologies, I'm willing to do it because on the other side is this incredible world that I want to live in.
Correct.
For the sake of time, we're going to have to move on. Goodbye.
Thank you.